Hello, I am DSS State Director Michael Leach.
And I am DAODAS Liaison Program Manager Michelle Cunningham. Did you know that April is Alcohol Awareness Month?
Approximately 141,000 Americans die from the effects of alcohol on average each year in the United States, decreasing average life by 26 years. That is higher than the number of Americans who died due to overdose in 2021. That's about 107,000 people. And I know according to the South Carolina Department of Alcohol and Other Drug Abuse Services, discharge data from 2021 of the approximate 26,000 people who are discharged from treatment services and approximately 16,000 people who are treated for alcohol use disorder, and this was for the people who received treatment. Many more go undiagnosed. And I know there's some South Carolina statistics too.
Yes, there are. According to the 2020 Behavioral Risk Assessment, it was reported that approximately women ages 18 to 44 years of age in South Carolina, about 40.1% of these women reported binge drinking.
That is a lot. That's horrifying. So Michelle, with all of that being said, what are some things to be aware of regarding alcohol? I mean, what do we need to understand?
Well, alcohol affects people's judgment, behaviors, thinking, and health. It can cause liver damage, cancer, high blood pressure. If a woman consumes alcohol during pregnancy, it can result in something called fetal alcohol spectrum disorder, or FASDs. That
is a lot, and that's scary. And so people need to understand that and be thinking about all the consequences or effects that this could have, right?
Think before you drink.
Okay. So my next question, what is fetal alcohol spectrum disorder?
FASDs, or fetal alcohol spectrum disorder, can occur when a person is exposed to alcohol before birth. Alcohol in the mother's blood passes to the baby through the umbilical cord. So anything that mom drinks, baby drinks too.
Okay.
There is no known safe amount of alcohol during pregnancy and no safe time to use during pregnancy. Alcohol can cause problems for a developing baby throughout the pregnancy, including before a woman knows she's pregnant. So within the first 4 to 6 weeks, women can be drinking and not know they're pregnant, and this can have harmful effects on the developing baby.
Wow, okay.
All types of alcohol are equally harmful, including wine, beer, mixed drinks. There's no cure for FASD. The only way to prevent it is by not consuming alcohol if pregnant or if someone thinks they could be pregnant. It's important to know that it's never too late to stop alcohol use during pregnancy because brain growth takes place throughout the entire pregnancy. So stopping alcohol use at any time during pregnancy will help improve the baby's health and well-being. It's also important for everyone to ask during any health visit, any visit, to assess alcohol substance use. The earlier that substance use or alcohol use is identified, the earlier that we can get supportive services and treatment for those individuals.
Okay. So next question, how do you assess for alcohol use in pregnancy or after the baby is born? What does that look like?
So there are many screening questions that people can ask.
Okay.
There's screening, brief, intervention, referral for treatment, or people know it as SBIRT. Okay. And healthcare providers, home visitors can ask, and it just assesses it could be male or female. They just assess if they're using any type of substance, which should be drugs and or alcohol.
So is it hard to ask these questions?
It's very hard because sometimes you don't want to know the answer, you don't have resources, you don't feel comfortable asking the question.
Right.
There's also a stigma attached to asking people questions, not asking others. They base it on how sometimes people look or their professional occupation. So it's important to ask everybody because you never know.
Right. And asking is important, and getting an answer that's truthful is as equally as important, right? So that we can figure out what the next steps are, right?
That's
Assessing,
right.
The level of need and again, what are the action steps needed after that, right? Is it important to discuss with parents and caregivers anything? Do we need to ask them anything?
I think, first of all, we just need to ask how they're doing.
Okay.
Never judge a person by one answer that they give one time. You want to make sure that you constantly reassess them for these things because conditions change. Substance use might pop up, and sometimes people have a habit or an addiction and they don't even know about it. So it's good to ask families about these questions because oftentimes we're their first source that we can help get them into treatment or services or supports.
Okay, so the earlier the identification and interventions, the better the outcomes for the child and family.
Yes.
Okay. What are some of the signs or symptoms of FASD? Since we just talked about what it is, what are some signs and symptoms of that?
So this is a great question. A lot of people don't know. There is a myth and a misperception that 90% of those that have FASD actually have facial deformities or facial features that you can identify, which is false. Less than 10% actually have some type of facial feature. Usually these things are picked up by the time they're 18 months old or older. Sometimes it's when they're in school, and it's because they're having behavioral problems, often misdiagnosed as ADHD or autism. So some general characteristics is they might have low body weight, poor coordination, aggressive behavior, hyperactive behavior, difficult with attention, memory, difficulty in school, especially when it comes to math.
Right.
Learning disabilities, speech, language delays, intellectual disability or low IQ, poor reasoning and judgment skills, sleep and sucking problems as a baby. So this is why we want anyone working with an infant or the family to assess how are they sleeping, how are they eating, if there are any difficulties, because it can be the first sign. Vision or hearing problems, problems with the heart, kidneys, and bones as they develop. Sometimes they're shorter than average height, and they might have a small head size. And these are all things that can be detected as the child grows and develops.
That is a lot of signs and symptoms. Holy cow. In that situation, there are a lot of things that have to be done to help that child and family. Like, it looks like potentially a lot of appointments, a lot of educational support. I mean, there are things that have to get done, but again, going back to the early intervention, right? Making sure that we do those things, but then understanding the effects of alcohol in the first place.
Correct. And one of the biggest problems is getting those assessments and a diagnosis. The only way that a definitive diagnosis for FASD will be done is if there is a confirmed history of prenatal alcohol exposure. So that's why it's so important to ask these questions. Usually by the time that someone suspects as they're getting older in age, they're having behavioral problems, you know, they're failing to thrive in school and at home, and it's playing catch up. So it's being aware of these symptoms. A lot of times, like we said, it's often misdiagnosed as ADHD. So when a child's, you know, diagnosed with ADHD and they're not responding to medications or therapies, we have to think back a little bit further. What else could it be? And every child is a little bit different in how they respond. The FASD behaviors and the child themselves can change from one child to the next child. So it's important just to have kind of a foundation of assessment, identify, and then refer to supports as physicians, other occupational therapists, speech therapists. There's a lot of different people who come into play. So key is identifying alcohol and then assessing the behaviors and kind of knowing what's going on to then keep referring.
Okay. So how you are in a great space within the state as you work along the lines of child welfare, but you also work with DAODAS, and you are continually trying to improve systems. How do you see FASD in child welfare? What's the connection there?
So it's interesting because nationally, so we don't have, the problem is we don't have a lot of great data. So if you are going to say, Michelle, how many FASD children do we have in South Carolina? We can't give you an accurate estimate because we don't have that data. It's very hard to diagnose, and sometimes people will say, we're not going to make that diagnosis until we know the pre-alcohol exposure. But based on all the signs and symptoms, we can tell this is what it is. Child welfare nationally, it's estimated 1 out of 4 children in foster care have FASD.
Wow.
Again, misdiagnosed as ADHD
right.
or autism, and they're just not responding to traditional medication or therapy. So unfortunately, it's hard for the kinship caregivers, the foster care system, even our case managers to identify like what is going on, how do you respond, and sometimes these children go through multiple placements. And the biggest issue that these kids have is they need structure. They need some type of stability. So it's really important for all of us, from the treatment side to the medical professionals to us in child welfare, to kind of recognize and know what these children might need, and then work with those family supports to help educate them and make a stable environment for them as best we can, as well as the schools. Yeah,
it sounds like a lot of understanding and patience from a lot of different professionals in understanding that FASD may play a part in, again, the behaviors and some of these other things, which is really hard to do, but it sounds like structure and some consistency and making sure you have the right appropriate treatment is key for that. So potentially one in four children in the child welfare system have FASD, but maybe it's undiagnosed or unknown, right?
Correct.
Yeah,
It can be a lot higher. The other thing to think about too is these children grow into adults. And so we're often in society seeing adults that are failing to thrive, that have mental health, that have substance use disorders. And unfortunately, 30% nationally of those who are incarcerated are suspected to have FASD.
Wow.
So the mental health, the behavioral issues grow with the child. And if we don't have a strong understanding and supports in how to respond to those behaviors, a lot of times they wind up in the criminal justice system.
Yeah. And I suppose the best thing for a family would be figuring out to have the supports early on, so maybe the child welfare system isn't involved, right?
Right.
What are the professionals we can get and wrap around that family to make sure we have good understanding, treatment, awareness, and support around that family early on, right?
Exactly. And the conversations start prevention. You know, there's no cure for FASD. The only way you could is prevent it. So working with our partners across the state to address, drinking. Think before you drink, because it impacts you just not now, but can potentially impact you and your family in the future.
Yeah.
So, and then assessing too during pregnancy. A lot of women say they are still under the myth and misperception it's okay to have a drink of wine, red wine in the last trimester will help you relax, but we know there's no safe time or safe amount to consume at all. So it's consistent education, awareness, having this conversation. It's a difficult topic to address, but it's so important.
Yeah. So just don't do it.
Don't risk it.
Don't risk it, right? Don't risk it. Well, I appreciate this conversation. Your wealth of knowledge, and you do so much for South Carolina in a lot of different spaces, right? The medical space, the DAODAS space, the child welfare space, and it's making a huge difference. So it's awesome to have you here and learn more about FASD and the implications of drinking, for sure. So thank you all very much.